this is Dr. Nuke. Let me tell you about how I fired my doctor that I had recently. I presented for an appointment with my doctor in a dire, desperate state mentally. The doctor in question was both my primary care physician and my psychiatric med provider. Well, I presented in very, very rough shape, saying I needed help. And what did she do? She suggested, the Brattleboro retreat. She suggested when I said I thought I needed to go somewhere to get my mind straight. No, I didn't necessarily mean a hospital. The Brattleboro retreat is a psychiatric hospital in Brattleboro, Vermont. The problem with that made me angry, because they don't care about people in the psychiatric hospitals particularly. They just care about symptoms and illnesses. They don't care about people, and they have a materialistic approach to things that denies the soul and the spirit. Totally materialistic. And you might say, well, what about the Christian places? Those places are horrible. All they care about is the Bible, and nothing but the Bible. That's all they care about. I was in one of those places once, actually twice, 2 different places like that. And in one of them, there was someone who had a sore throat for a while, for about 3 weeks, apparently. That could be strep throat, potentially, which is very dangerous if untreated, and contagious as well. And yet they didn't have this person see a doctor. And they didn't even feed us hardly adequately. These places. They operated on a shoestring budget. Can't fault them for that, but they, again, all these places care about is the Bible, and they don't even care about the human person or whatever, except that they think, we're saving them from going to hell. Well, maybe not. I don't know. But back to my last doctor. Yes, I fired her because her suggesting that hospital. And then she said, let me go into another room and get a book. And so I waited. And a couple minutes later, she comes back into the room with a book, and I said, well, what book is it you went to get? And I said, it's book medications. At that point, I just got up and exclaimed to her, you're fired, and walked out in a huff. I didn't use any obscenities, no threats or anything like that. I just said, you're fired, and I walked out. Because I was sick to death of the medications being the be-all and the end-all of the mental health system. It's a cop-out for not doing things that need to be done for people in need. Now, I do take meds, and I'm not planning on stopping taking them anytime soon. And there is a place for meds, yes. But what got to me about this doctor that I was seeing is that she seemed to be singularly focused on medications to the exclusion of all else. Maybe that isn't where she was at, but that's the feeling I got. And it made me very angry. Very angry indeed. Yes. The mental health system is in a state of collapse here in Vermont, and in many other places too, no doubt. There are nowhere near enough psychiatric hospital beds. Now, I know I spoke ill of the Brattleboro Retreat, which is a psychiatric hospital in Vermont, but there is a definite place for hospitalization for some people, but that needs to be done differently. Perhaps the psychiatric hospitalizations would be more effective if they took a more holistic approach to the needs of the patient and allowed for soul and spirit without getting bogged down into forcing the Bible down people's throat or anything of that sort. But they need to be open to the soul and to the spirit. I remember I was at a hospital in the past, many years ago, and I wanted to see a chaplain. And the whole length of time I was there, I asked to see a chaplain, and I never got to see one. Never got to see a chaplain, even though I asked to see one multiple times. Such is the system's concern for people's spiritual needs. The whole paradigm is wrong. Wrong. The whole paradigm of hospitalization is wrong. The paradigm of mental health treatment, the paradigm of substance abuse treatment, the whole paradigm is just wrong, just plain wrong. They need to take, both for inpatient and outpatient treatment, they need to have an approach based on love and compassion and mercy and reconciling people to God and to each other. And yes, meds may be needed for some things, but they need to take care of everything that is ailing in someone's life in order to get their head on straight. I mean, what good is it to, for example, treat someone for drug addiction who is homeless and disabled or whatever and has nowhere to go? Well, what are they going to do when they get out, really? I mean, let's say they did try to be sober. Let's say they actually were sober, being homeless. I mean, a pretty horrible life. Be even worse life being sober and homeless than being drunk and homeless. Well, maybe not for everyone, but I can't imagine it. It's just horrible. They just don't care. And what's society do? Well, take what they did in California, for example. The governor of California ordered that all homeless encampments be cleared. Not only that any municipalities that didn't do it would have funding from the state of California withheld. I mean, horrible. Many of these people are mentally ill. It's just monstrous that there is no place for these people and others to go. Well, anyway, I guess I've rambled on enough. As I said, I fired my last doctor. I'm in the process of getting another doctor. I completed the paperwork for it and have an appointment coming up in my first appointment with a new doctor in January. Bye.